Hello everyone, welcome to my channel. We're gonna talk about the fronto occipital muscle. First of all, fronto occipital muscle. The function of this muscle is to create forehead wrinkles. This muscle originates from superior neutral line. I'm gonna show you this line in this picture. This is this blue line here is the superior neutral line. This purple one here is highest nuchal line. And in this black and white picture, you could see highest nuchal line at top, then superior neutral line, then median neutral line. So, as I was saying, function of this muscle is to create forehead wrinkles. This muscle is broad and it has two bellies. One belly is located in the frontal area and the other is in the occipital area. This muscle lifts the eyebrows upward. The frontal part of this muscle is transferred to the skin of the two eyebrows, and this muscle is located on the calvaria. Here I want to explain the scalp layers. First of all, the first area is the skin. Beneath the skin is connective tissue or superficial fascia, which is somewhat fatty and its depth is quite significant. Below, it is the aponeurosis of the fronto-occipital muscle, which is an extremely strong white tissue. So, underneath aponeurosis, we have loose connective tissue, which is loose, and most of its elements are fat. And then, underneath the aponeurosis, we reach to periosteum. So, here are all the layers of scalp. S stands for skin, then connective tissue, aponeurosis, loose connective tissue, and periosteum. So, fronto-occipital muscle had two bellies. The belly, which is in the occipital area, is connected to the highest nuchal line, as you can see in the picture. This is the insertion. And before I'm gonna talk about the origin, I'm gonna show you this picture. This picture shows the elevations above the eyebrows, which are the frontal sinus area, are called superciliary arches. And in this picture, you can see the frontal sinus. And in this picture also, this is the frontal sinus. As you can see, the frontal belly of fronto-occipital muscle connects to the supraciliary arcs and also the skin between the supraciliary arches and along with it, and the skin of the superciliary arches is lifted as a result of its contraction, and it creates skin wrinkles. So, we're going to talk about the cranial nerve, or nerve 7. One branch is sent towards the temporal area called the temporal branch. A branch is sent to the posterior area, which is called the posterior auricular. The temporal branch of cranial nerve is responsible for innervation of frontal belly of fronto-occipital muscle. And the posterior part of the muscle is also innervated by the posterior auricular.